Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Jessica Kovar, physical therapist with Terrebonne General Health System. Today we're going to be discussing chemotherapy-induced peripheral neuropathy, or CIPN. Terrebonne General provides therapy to relieve these symptoms and improve patients' quality of life. Welcome to the show, Jessica.
Thank you, Rhonda.
All right, well, let's get started. Tell us a little bit about yourself and your role at Terrebonne General.
Well, my name is Jessica Kovar. I've been a physical therapist at Terrebonne General for a little over 6 years now. I work in the outpatient clinic, and we work with a variety of patients, from orthopedic patients, neurological patients, and now we're seeing more of our oncology patients.
Okay, well, great. Well, tell us more about what is chemotherapy-induced peripheral neuropathy. It is a mouthful.
Yes,
so
it is.
Please explain.
So peripheral neuropathy is any sensor, motor, or autonomic damage to the nervous system. And so more recently, we have been seeing the peripheral neuropathy side effects in patients that have undergone chemotherapy. So now there is a new diagnosis called chemotherapy-induced peripheral neuropathy.
Okay, and what are the symptoms, and are they the same for every cancer patient?
I wouldn't say for every cancer patient. The symptoms could vary. More than likely, we see the numbness and tingling in the hands and feet. There can also be some weakness involved, difficulty with grip strength, grabbing things, buttoning clothes. Also, changes in hot or cold, like the feelings of hot or cold, where there are less or more.
Okay, so it's definitely something they will notice.
Correct, yes.
Okay, and what types of patients do you treat?
Well, it can vary. The CIPN, the chemotherapy-induced peripheral neuropathy, can happen in any of the cancer patients that have undergone chemotherapy, whether it's breast cancer or non-Hodgkin's lymphoma, prostate cancer. It can vary.
Okay, and physical therapy and occupational therapy are what you use. And what's the difference between those two?
So physical therapy, we work on more gross motor activities, look at overall strengthening, the patient's balance, helping them to walk again if they have difficulty walking, where occupational therapy works on more fine motor skills, those activities of daily living, being able to eat or to brush your teeth, go to the bathroom, dress yourself.
Explain what the treatment involves.
So once we get the referral from the doctor and schedule, what we have an initial patient evaluation, we treat each patient differently. Nothing is cookie cutter. When the patient comes in for their evaluation, we get their background information from them, find out what's going on. Then once we get into our examination, we look at strength and balance, watching them walk, climb stairs, and a various number of other outcome measures that we use. And from there, we find out what their deficits or their problem areas are. And then with that and finding out what are their goals, what do they want to get back to, then we come up with a comprehensive plan of care that is individual, very specific to each patient, to getting them back to doing the things that they would like to do.
And what are the benefits of therapy?
There's so many. It could be something as simple as, just walking. Patients have difficulty standing up because of weakness or lack of sensation. Also, going to the grocery store or cooking or going back to cleaning their house, picking up their child or grandchild. So we work on specific problem areas and work on getting those individuals back to doing the things that they enjoy.
They're probably so grateful for that, I'm sure. Well, tell us how we can learn more about your services.
So I definitely always encourage patients to be an advocate for themselves. Definitely this episode, anybody that's going to watch this can learn more about it and get with their doctor. If they're experiencing any of these symptoms, you always want to be very vocal and verbal and communicate with your doctors and request a prescription to physical therapy. And then as soon as we receive the referral from the doctor, we don't hesitate. With less than 24 hours, we're trying to get that patient scheduled and to come in for that initial evaluation.
Okay, I wanted to ask, how soon can a patient expect to see results once they start working with you?
That varies, like everything, nothing is cookie cutter. And the one thing we have noticed is that patients that do come to therapy and are compliant with coming to therapy, and also we create a home exercise program for them to be able to do exercises at home. The more that they are compliant with those activities, the better the results and the sooner the results.
Right, so this is hands-on therapy and treatment. And,
Absolutely.
And the patient is expected to do some things.
A little homework.
Okay, great. All right, well, Jessica, thank you so much for being with us today and for all you're doing for our cancer patients.
Absolutely, thank you.
To find out more about how this treatment can help you, call the Terrebonne General Health System Rehabilitation Department at 873-3555 or visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.